Hello and welcome to our hematology tutorial series. My name is Clement Chilambe from Clement Chilambe Medical Tutorials, and today we are starting with tutorial 1, anemias. This is our first tutorial under this playlist, and therefore we need to also recognize that anemia is one of the most important topics in hematology and also in other areas such as clinical medicine. And we know that this hematology is a branch of medicine and a major biomedical science that deals with the study of blood, its components, and also its disorders. And anemia is one of the most common hematological disorders worldwide. Therefore, in this tutorial, all the questions that we are going to discuss here is based on definitions of anemia and their clinical significance. And also we're going to do these questions incorporate the main types of anemia based on red blood cell size, such as microcytic, macrocytic, and also normocytic. And then these questions will also tackle issues that has to do with the common causes of these anemias, laboratory findings, and also diagnostic approaches. And also in the next lecture, which is tutorial 2, we are going to discuss the clinical cases to help us apply the knowledge in real life scenarios. And without wasting much of the time, let's start with the discussion of this tutorial, which is just a multiple choice questions tutorial. They are the ones that we are going to discuss for today. And this is actually very important because you need to practice. Practicing is one of the things that you need to do as a student, because you are expected to write tests, you are expected to write an exam, and therefore you can't just keep reading textbooks and also slides shared by lecturers. You need to apply the information that you're learning. The more you practice through these questions, the more you're getting the information better. So let's start with our first question. I will be using a pen, to circle the answer and all that. When you feel like answering the question, and I'm encouraging you to pause at least a question so that you get to answer it yourself and then see the answer that we choose. In that manner, you find out that you are also exercising, you're also building on knowledge, so that if you are given that paper alone, you are able to answer these questions. Okay, so the first question is, what is the World Health Organization definition of anemia? Okay, which one is the World Health Organization definition of anemia? Okay, so A is saying anemia is a condition in which the hemoglobin content of blood is lower than normal as a result of a deficiency of one or more essential nutrients, regardless of the cause of such deficiency. B is saying anemia is a condition in which the red blood cell count is lower than normal. Then C, a condition in which the blood volume is lower than normal. And D saying it is a condition in which the blood pressure is lower than normal. So we are looking for the World Health Organization definition of anemia. So which one do you think is the correct answer here? Okay, so the correct answer is A. Okay, the correct answer is A. Anemia is a condition in which the hemoglobin content of blood is lower than normal as a result of a deficiency of one or more essential nutrients, regardless of the cause of such deficiency. This is how the World Health Organization defines anemia. Okay, so we need also to recognize that this World Health Organization definition centers on a reduced hemoglobin concentration, as we can see. Okay, reduced hemoglobin concentration due to a deficiency of essential nutrients. Okay, now when we talk of a low red blood cell count, we know that while a low red blood cell count often accompanies low hemoglobin, the hemoglobin itself is the defining criterion, yes, that we should use. Low blood volume is hypovolemia, and low blood pressure is hypotension, which are not actually definitions of anemia. All right, let's move to the second question. So according to the World Health Organization, what is the worldwide prevalence of anemia? Okay, according to the World Health Organization, what is the prevalence of anemia? A, over 20% of the world's population. B, over 25% of the world's population. C, over 30% of the world's population. And D, over 35% of the world's population. Okay, so according to the World Health Organization, this is very important. If you have read in some literature talking about the prevalence of anemia, of course it is quite well that they might give percentages that are in ranges, but for this one, understanding the question when they say according to the World Health Organization, which means they're actually looking for a prevalence of anemia according to the World Health Organization. Keyword. Okay, which one is it? Which one did you read about? Okay, so the answer here is the 30%. So the global prevalence of anemia is over 30%. So here, over 30%, which makes anemia one of the major public health issue. All right. Question number 3. Which of the following is a cause of decreased or ineffective marrow production? Which of the following is a cause of decreased or ineffective marrow production? A, blood loss. B, hypersplenism. C, lack of iron, vitamin B12 or folate. And D, hemolysis. So understand the question first. The cause of decreased marrow production or ineffective marrow production. We are talking about the bone marrow, which is one of the major sources of blood production. Now, which one do you think is the right answer among the answers that we have from A to D? So the correct answer is C, right? The correct answer is C. So we need to recognize that decreased or ineffective production is due to the bone marrow's inability to produce a healthy red blood cells. Okay, so a lack of essential nutrients such as iron, vitamin B12 or folate directly impairs this production. Blood loss, which is on A here, and hypersplenism, which is on B, and hemolysis on D, are causes of increased red cell or red blood cell loss or destruction, not really following the question that we've discussed. Yeah, so we pick C as the correct answer. Question number 4, which of the following is a symptom of iron deficiency anemia? A, jaundice. B, glossitis. C, neurological changes. And D, all of the above. Which of the following is a symptom of iron deficiency anemia? Which one do you think is the correct answer here? Among the 4 choices that we have. Okay. So we need to also understand this question, right? We've read about iron deficiency anemia in our slides and in our questions, and right now you might have, you know, a lot of answers or just one answer. But if you have a lot of answers, that is okay. If you have one answer, well, you need to reconsider that. Why? Because glossitis, which is actually the inflammation of the tongue, is a classic symptom of iron deficiency anemia. And then jaundice is a sign of hemolysis, and then not iron deficiency anemia. And then neurological changes are characteristic of vitamin B12 deficiency, not iron deficiency. So which one are we picking here? I have already said it. It's glossitis. Okay, glossitis. So why jaundice? Jaundice is just a sign of hemolysis, not iron deficiency anemia. Okay, neurological changes, this refers to vitamin B12 deficiency, not iron deficiency anemia. All of the above, we are saying no. Why? Because neurological is for vitamin B12. Therefore, A, C, D are wrong choices. The correct choice is glossitis. Question number 5. Which of the following is the best method for diagnosing iron deficiency anemia? And I will have to mention one thing. When we are discussing anemias, it is imperative that we know, first of all, the etiology of the anemia, the classification at which it falls, and also the definition, first of all, before we even come to the etiology. And you need to know the laboratory diagnosis of iron deficiency anemia, not forgetting the complications and also the signs and symptoms. Once you know that about anemia, then that you are good to go and you be able to think critically, especially when you are answering questions. So which of the following is the best method for diagnosing iron deficiency anemia? A, CBC, complete blood count. B, endoscopy or colonoscopy. C, iron studies such as TIBC and serum ferritin. And then D, they're saying all of the above. Okay, so which one is the correct answer here? So the correct answer, what do you think it is? Let's start analyzing the answers. Complete blood count. Yes. When diagnosing iron deficiency anemia, I should state that a comprehensive approach is actually the best. And therefore, a complete blood count identifies anemia. Okay, iron studies like low ferritin and high total iron binding capacity, which is TIBC, confirm iron deficiency anemia as the cause. And endoscopy or colonoscopy can locate the source of blood loss if that is the underlying issue. And therefore, the correct answer is all of the above. A comprehensive approach is the best. So the correct answer, question number 5, is all of the above. All right. Then question number 6. What is the best or what is the recommended treatment for iron deficiency anemia? What is the recommended treatment for iron deficiency anemia? A, oral iron supplements. B, parenteral iron therapy. C, diet counseling and rest. D, all of the above. Okay. Which one do you think is the answer here? Understand the question first. Recommended treatment. And you know the condition that we are actually talking about. Recommended treatment for iron deficiency anemia. So, the best answer here is D. Okay, it's all of the above. Why are we saying the best answer is all of the above? It's because treatment is multifaceted. Okay, it's multifaceted. It's comprehensive as well. So oral iron, when you talk of iron supplements, oral iron supplements is the first line. Okay, but parenteral iron therapy, which is the intravenous iron, is used if oral is not tolerated or effective. This we must also know. And also diet counseling addresses the root cause, right? And rest also helps the symptoms of fatigue. And therefore, we're saying all of the above are the answers. That they are recommended treatment for iron deficiency anemia. All of the above. All right. We move to question number 7. What is the characteristic feature of megaloblastic anemia? Okay, what is the characteristic feature of megaloblastic anemia? A, small, dense red blood cells. B, large, fragile red blood cells. C, sickle-shaped red blood cells. And D, spherical red blood cells. Which one do you think is the correct choice? All right, so the correct choice here is B, large, fragile, red blood cells. Okay, these are the characteristic feature of megaloblastic anemia. Why are we saying that? Megaloblastic anemia is caused by B12, or folate deficiency, right? And it is actually defined by the presence of the large, immature, and fragile red blood cells known as the megaloblasts. Due to what? We just said folate deficiency, and therefore all this is due to impaired DNA synthesis. All right, so question number 7, the correct answer that we have is B. We move to question number 8. Okay, so question number 8, what is the main cause of cobalamin, vitamin B12 deficiency? So cobalamin deficiency, what is the main cause? A, gastric mucosa not secreting intrinsic factor. Then B, nutritional deficiency. C, hereditary defects of cobalamin utilization. And D, all of the above. Which one do you think is the correct answer? The main cause of cobalamin deficiency. So cobalamin deficiency can actually arise from several mechanisms. Okay, what are these mechanisms? 1, lack of intrinsic factor. Okay, we are referring to pernicious anemia here. Then 2, it can be due to inadequate dietary intake. such as, let's give an example of a strict vegan diet, isn't it? Or 3, it can cobalamin deficiency can arise from a rare hereditary defect that can affect its utilization, and therefore D is the correct answer. All of the above are the main cause of cobalamin deficiency. So D is the correct answer that we pick from question number 8. Question number 9. What is the purpose of the shedding test in cobalamin deficiency? What is the purpose of the shedding test in cobalamin deficiency? A, to determine if the patient has pernicious anemia. B, to measure the patient's vitamin B12 levels. C, to assess the patient's intrinsic factor secretion. And D, all of the above. So we are actually talking about one of the best or the tests that are very specific for cobalamin deficiency, and therefore we are trying to analyze all the answers that are here. Which one do you think, or which ones do you think, or which choice here do you think is the best for question number 9? Okay, so the purpose of the shedding test in cobalamin deficiency, let's just talk about shedding test. The shedding test was actually a specific test that was designed to determine if a patient could absorb vitamin B12, right? So its primary purpose is also to actually diagnose pernicious anemia, right? To diagnose pernicious anemia by identifying impaired absorption that's corrected with the administration of the intrinsic factor. So which one do you think is the correct answer? Of course, A is the best answer. The shedding test in cobalamin deficiency is used to determine if the patient has pernicious anemia. All right, that is question number 9. We move to question number 10. What is the common cause of folic acid deficiency? What is the most common cause of folic acid deficiency? A, poor dietary intake. B, malabsorption syndromes. C, alcohol abuse. And D, all of the above. What is the most common cause of folic acid deficiency? Poor dietary intake, malabsorption syndromes, alcohol abuse. D, all of the above. Which one do you think is the correct answer here? All right, so all these are actually the common causes. Poor dietary intake, malabsorption syndromes, alcohol abuse are actually the most common causes of folate deficiency. Okay, poor dietary intake is very common, right? But malabsorption and chronic alcohol abuse are also significant contributors. So here we go with all of the above. So our answer on question number 10 is all of the above. Let me just be marking like this. All right, question number 11. Question number 11. What is the characteristic feature of aplastic anemia? What is the characteristic feature of aplastic anemia? A, increased production of red blood cells. B, decreased production of all blood cell types. C, increased destruction of red blood cells. D, decreased production of platelet. Which one is it? Okay, you've learned about aplastic anemia, and it's got best definition actually. So aplastic anemia, which one first of all do you pick here? Directly from the definition of aplastic anemia, we're going to say decreased production of all blood cell types is a characteristic feature of aplastic anemia. Yes, aplastic anemia is defined by the bone marrow failure, all right, leading to what is known as, I like that term though, pancytopenia, which is a decrease in all blood cell lineages. Okay, that includes red blood cells, white blood cells, and also platelets, and therefore B is the best choice for question number 11. We move to question number 12. 12. What is the main treatment for aplastic anemia? What is the main treatment for aplastic anemia? A, blood transfusions. B, immunosuppressants. Okay, C, bone marrow transplantation. And D, all of the above. What is the main treatment for aplastic anemia? Which answer do you pick here? So question number 12, we are picking, before we pick any answer, let me just say this statement so that you understand and you'll be able to pick the statement. So treatment for aplastic anemia actually is we need to recognize that it's tailored for what? It's severity. Okay, how severe is the case of aplastic anemia? Supportive care includes transfusions. Supportive care also includes immunosuppressants, which are used for autoimmune causes, right? And also bone marrow transplantation is the curative treatment for severe cases in eligible patients. Right. That tells us that the correct answer for question number 12, the correct choice is all of the above. All right. So all of the three choices here are the main treatment for aplastic anemia. These multiple choice questions are very important because from these you're actually learning about so many things. The actual condition itself. This is for practice. Okay. These questions were generated and formulated for you to practice the knowledge that you've so far acquired. All right, question number 13. Question number 13. What is the underlying cause of thalassemia? What is the underlying cause of thalassemia? A. Autosomal recessive genetic disorder of inadequate production of normal hemoglobin. B. Autosomal dominant genetic disorder of excess hemoglobin production. C. Acquired condition due to exposure to toxins or radiation. And D. Viral infection. Which one do you think is the underlying cause of thalassemia among the choices that we've just mentioned? All right. So thalassemia, we know that it is an inherited disorder, okay? An inherited autosomal recessive disorder that is characterized by genetic mutations that lead to what? That lead to reduced or absent synthesis of one of the globin chains. All right, what are those globin chains? The alpha or beta of hemoglobin. Now, this tells us that choice A is the best answer. All right. So the underlying cause of anemia, of thalassemia, is the autosomal recessive genetic disorder of inadequate production of normal hemoglobin, alpha or beta chains. There's thalassemia major, thalassemia minor, which we'll discuss later. Okay, let's go to question number 14. What is the main clinical manifestation of thalassemia major? Right. A. Asymptomatic. B. Splenomegaly and hepatomegaly. C. Life-threatening. D. Both B and C. All right. What is the main clinical manifestation of thalassemia major? That is question number 14. All right. So thalassemia major, before we conclude to the answer, you've answered, but if you've not answered, let this help you answer this question. I want to say something about thalassemia major. So thalassemia major is a severe, actually, it's a severe life-threatening condition, right? And thalassemia major actually presents with severe hemolytic anemia. Then severe hemolytic anemia leads to extramedullary hematopoiesis, which causes hepatosplenomegaly, right? And its severity makes it life-threatening as well. So what are we saying? We are saying that both B and C are actually the correct answer, right? Are actually the correct answer under question number 14, and therefore we pick D as the answer, because D is saying both B and C, and B and C are actually independent. So the one that's combining both is D. So we pick D as the correct answer here. We go to question number 15, right? What is the treatment for thalassemia major? Okay, what is the treatment for thalassemia major? A. Specific drug or diet. B. Blood transfusion with IV, deferoxamine. And C. Bone marrow transplantation. D. None of the above. Okay, what's the best treatment, or what's the treatment for thalassemia major? So question number 15, the mainstay, okay, the mainstay of treatment is actually regular blood transfusions to correct anemia. Okay, so this leads to iron overload, and this iron overload sometimes is managed with what we call chelation therapy, like deferoxamine intravenously, and of course, well, bone marrow transplant can be curative. Option B is actually the primary one, right? And the ongoing treatment, and therefore we say that blood transfusions, intravenous deferoxamine, is the treatment for thalassemia major that is currently ongoing or available. So B is our correct answer, actually. Right. Question number 16. What is the characteristic feature of sickle cell anemia? What is the characteristic feature of sickle cell anemia? A. Increased red blood cell production. B, decreased red blood cell production, C, abnormal sickle-shaped red blood cells, D, increased red blood cell destruction. Which one is the correct answer? This is very easy. All right, so the hallmark of sickle cell anemia is what? The polymerization of abnormal hemoglobin S under low oxygen conditions. This reminds me of the beloved sodium 0.2% sodium metabisulfite. All right. So the low oxygen conditions that the red blood cells are exposed to causes red blood cells to deform into a sickle shape. Right. So which one is the best answer here? The best answer is the characteristic feature of sickle cell anemia is the abnormal sickle-shaped red blood cells. Let's go to question number 17. What is the primary cause of pain crisis in sickle cell anemia? What is the primary cause of pain crisis in sickle cell anemia? A, vaso-occlusive disease. B, increased infections. C, organ damage. And D, all of the above. What is the primary cause of pain crisis in sickle cell anemia? You've learned this. So sickle cells are very stiff, right? And they are very sticky. They block small blood vessels. Okay, this is called vaso-occlusive. Okay, so this vaso-occlusion causes ischemic pain, and it's actually the primary mechanism of pain crisis. Infections and organ damage are also consequences of the disease, not the direct causes of the pain crisis. No, right? So organ damage and increased infections are actually the consequences or complications rather. And therefore we are saying that the best answer that we're going to pick from question number 17 is vaso-occlusive disease. So we know what happens. As we've said, there is the ischemic pain due to this vaso-occlusion, the blocking of the small blood vessels, and this is actually the primary mechanism of a pain crisis. So we pick A to be the correct answer. We go to question number 18. What is the most appropriate management for a 2-year-old girl with sickle cell disease and fever? Okay, this sounds like a clinical scenario questions, but it isn't. It's just a straightforward questions. Clinical scenario questions are in tutorial 2. This is just tutorial 1. We are introducing anemias and we need to have the general knowledge. Therefore, what is the best answer for question number 18? A, oral antibiotics. B, hospitalization and intravenous antibiotics. C, observational and supportive care. D, blood transfusion. What is the most appropriate management for a 2-year-old girl with sickle cell disease and fever? The correct answer, okay, before you shout out the correct answer, children with sickle cell disease are functionally asplenic. That we must know, and you must know from your books and lecture slides. And these children are at high risk for the overwhelming sepsis from the encapsulated bacteria, right? Fever here, this one that you're seeing here, is actually a medical emergency requiring immediate hospitalization for broad spectrum intravenous antibiotics. And therefore, the answer for question number 18, the best answer that we pick from here, is hospitalization and intravenous antibiotics is the most appropriate management for a 2-year-old girl with sickle cell disease and fever. All right, question number 19. What's the main genetic defect in hereditary spherocytosis? What is the main genetic defect in hereditary spherocytosis? A, defects in ankyrin and spectrin. B, defects in G6PD enzyme. C, defects in hemoglobin structure. Then D, defects in red blood cell membrane. Which one is it? Hereditary spherocytosis. The lecture slides that are coming that you might have access to under this channel comprehensively explains what hereditary spherocytosis is, and therefore from the notes and from the knowledge that we have is, of course, defects in red blood cell membrane is of course broadly correct. we need to understand the molecular defect as involving the cytoskeletal, okay, cytoskeletal proteins like what? Ankyrin and spectrin. So these proteins are actually very, very critical for maintaining the bioconcave shape that we talk about every day of the red cell. And therefore, this is more precise than the general D answer, which is the red blood cell membrane defects. And therefore, which one do we pick? We choose A to be very specific. No, not specific, but precise, right? Defects in ankyrin and spectrin. So we choose one which is the best and precise. Because when we talk of defects in ankyrin and spectrin, we're also talking about red blood cell membrane, but not always. So we pick A to be the correct answer. Question number 19. Question number 20. What is the primary trigger for acute hemolysis in G6PD deficiency? Okay. What is the primary trigger for acute hemolysis in G6PD deficiency? A, infection, B, fava beans, C, oxidant drugs, and D, all of the above. So which one is it? G6PD deficiency, or G6PD itself, is just an enzyme that protects red blood cells, right, from oxidative stress. This is what we know. And infections, fava beans, and oxidative drugs like certain antibiotics and antimalarials all create the oxidative stress, triggering what is known as the acute hemolysis in deficient individuals. And therefore, we choose D to be the correct answer. And on question number 20, this is the primary trigger for acute hemolysis in G6PD deficiency. All right. So question number 21. What is the most common symptom of acute hemolysis in G6PD deficiency? So what is the most common symptom? All right. In the previous question, I even touched one of the mechanisms of G6PD deficiency, and from just a statement, and therefore I expect us to have a common symptom in our mind. So which one? Let's look at the options. A, anemia, B, jaundice, C, hemoglobinuria, and D, all of the above. Which one do you think is the correct answer? Okay, so hemoglobinuria, which is actually dark urine, is the most common symptom during an acute hemolytic episode in G6PD deficiency, right? Anemia and jaundice that are listed here also occur, but hemoglobinuria is the most characteristic presenting sign, and therefore we choose hemoglobinuria to be the best answer. Question number 21. 22. Which of the following is a characteristic sign of thalassemia major? Which one is a characteristic sign of thalassemia major? Okay. You might be wondering, no, just from talking about thalassemia major, but look at this question properly. It might come this way. Look at this. Look at the options that are here. Microcytic anemia, they're saying is a characteristic sign of thalassemia major. Splenomegaly, crooked skull X-ray appearance, and D, all of the above. Which of the following is a characteristic sign of thalassemia? So when questions say, be careful and be able to ensure that you understand the question, especially when that question under the choices we have all of the above. Please note that at least two answers there might be what? Might be correct. Okay, might be correct. When they say all of the above, at least some 2+ answers are actually correct, and therefore these questions requires us to review the notes and also the books, and not only that, but to think critically as to what is this question looking for, what is the lecturer or someone tutoring me trying to test me here. So which one is the best answer here? So thalassemia major causes a severe microcytic anemia. We know that, and therefore there is also an issue of splenomegaly, which is common. Why is splenomegaly common in thalassemia major? Because this is splenomegaly is due to extramedullary hematopoiesis and also what is known as the red blood cell sequestration, and therefore, also the crooked appearance on the X-ray, okay, is a classic sign or finding due to what? bone marrow expansion. Therefore, we are saying all of the above is the correct choice. All right, but look at the question the way it was asking. As which one of the following, or which of the following is the characteristic sign? So you see, you might think, oh no, it's just one answer here. No, you need to think. You need to note that, okay, they are trying to test me on something here. Question number 23, what is the most severe form of thalassemia? A, thalassemia major, A, thalassemia minor, B, thalassemia major, C, hemoglobin H disease, and D, hydrops fetalis. Which one is the most severe form of thalassemia? So hydrops fetalis here is actually the correct answer. So hydrops fetalis results from the complete absence, complete absence of alpha globin chains, which is actually the most severe form. There's nothing like, okay, only alpha chains or only beta chains, but for this one, we're actually talking about all the two chains, which is the alpha globin chains, okay? It causes severe anemia and also heart failure in utero, and it's actually typically fatal before or shortly after birth. This is what we actually know. Question number 24, what is the primary cause of hemolytic anemia? What is the primary cause of hemolytic anemia? We have a certain segment, another segment on hemolytic anemias, but look at this. We also have this question which we need to tackle through. Hemolytic anemia is a big topic. That's we have separate tutorials under that, and since it's anemia, it should fall under tutorial 1, right? So A, abnormal hemoglobin, B, enzyme deficiencies, C, RBC membrane abnormalities, and D, all of the above. What is the primary cause of hemolytic anemia? Which one do you pick? Okay, so hemolytic anemia, which is actually the increased, in layman's language, increased RBC destruction. It has got many causes, right? This is what we should know. And the main causes can be categorized as intrinsic red blood cell defects, right? Like abnormal hemoglobin, enzyme deficiencies, and also membrane defects or membrane abnormalities. Or they can be extrinsic, such as immune or mechanical. And what are we saying therefore? We are saying all of the above is the best choice that we pick. So it's the primary cause of hemolytic anemia. All these abnormal hemoglobin, enzyme deficiencies, RBC membrane abnormalities, all these four here are actually the the causes of hemolytic anemia, and they are intrinsic causes. There are also extrinsic causes, such as those for immune and also mechanical. 25. What's the most common complication of acquired hemolytic anemia? A, tubular necrosis, B, splenomegaly, C, jaundice, D, thrombosis. So what's the common complication of acquired hemolytic anemia? Okay, so there is accumulation of hemoglobin, first of all, molecules. There is accumulation of hemoglobin molecules from the intravascular hemolysis, which can actually lead to to the obstruction of the renal tubules, and also not only that, that can also lead to acute tubular necrosis, which is actually a serious and a common complication. So we pick A to be the most common complication of acquired hemolytic anemia. So we pick A here to be the best choice. All right, so question number 26, what is the characteristic feature of sickle-shaped red blood cells? What's the characteristic feature of sickle-shaped red blood cells? This one has come again, trying to come back. So A, stiff and sticky, B, easily move through blood vessels, C, increase oxygen delivery, D, decrease oxygen delivery. So which one is the best answer? The characteristic feature of sickle-shaped red blood cells is the stiff and sticky. This one is the one that we're going to pick here. Okay, this one is the one that we're going to pick here. Why are we picking this? We know that the sickling process makes the red blood cells rigid, and also they become adhesive. So This is actually the key pathophysiological feature that leads to the vaso-occlusion that we did talk about, and also the clinical symptoms of the disease. That's question number 26. Then 27, what is the primary cause of organ damage in sickle cell anemia? All right, you can see here we actually marked vaso-occlusive disease as the best answer. So yeah, the vaso-occlusion is actually the problem, okay? Is the primary cause of organ damage sickle cell anemia. So question number 27, we have vaso-occlusive disease as the best answer. Yeah, chronic anemia is a problem. Chronic anemia is a problem. Wow, it is a problem, of course. The primary mechanism, but for the primary mechanism for organ damage, such as stroke, or renal failure, or acute chest syndrome, is the recurrent episodes of vaso-occlusion, which causes ischemic injury. We did discuss this, yeah. All right, 28. Which of the following is a recommended preventive measure for sickle cell crisis? A, avoid dehydration. B, avoid extremes of temperature. And C, maintain a healthy lifestyle. D, all of the above. And we know that preventing crisis involves avoiding non-triggers, right? What are these non-triggers? Dehydration and extreme temperatures can actually precipitate sickling. And so avoiding them along with general health maintenance is key. And therefore we are saying D is the best answer for question number 28. All these are recommended preventive measures for sickle cell crisis. All right. Question number 29. What is the main genetic defect in G6PD deficiency? A, autosomal dominant. B, autosomal recessive. C, X-linked recessive. And D, X-linked dominant. Which one do you think is the best answer here? Okay, so the gene for the G6PD enzyme is actually located on the X chromosome. Okay, so when just that statement tells us that A and B are incorrect. All right, and we need to also recognize that the deficiency is inherited in an X-linked recessive pattern. This is why it is actually more common in males, right? So the best answer that we get is C, which is the X-linked recessive. X-linked recessive. That's question number 29. Question number 20, which is 30, which is our last question. What is the primary clinical manifestation of acute hemolysis in G6PD deficiency? Okay, the primary clinical manifestation of acute hemolysis in G6PD deficiency is I think we did discuss this, hemoglobinuria, right? We discussed this on question number 21, and we identified hemoglobinuria as the most common and characteristic symptom of an acute hemolysis episode in G6PD deficiency, and therefore C is our best choice here. What do we say? We say thank you for listening and thank you for attending this tutorial. See you in the next tutorial where we'll discuss about the clinical scenario questions, not these direct questions, but we are going to discuss the clinical scenario questions. Thank you so much and see you in the next lecture.